I absolutely believe that public health departments are trying to do their very best, and community health workers can really be allies to public health departments in this fight.
We're like the bridge that can connect both the health providers and the communities with resources.
We're like that drop of water that keeps landing on the rock until it makes a hole. We're like that. We're consistent. So by us being consistent, the community gets to trust us more. And they know that if they need something, we're here for them.
We are able to get connected with the community, and there are people out there who are struggling prior to COVID and now with COVID.
If I'm a local public health department and I'm thinking, how do I build a workforce that's capable of responding to COVID, but who can also address the root cause issues that cause chronic disease or the opiate crisis? That's who community health workers really are.
We're in the middle where we can just speak to both sides and explain in detail and hopefully get them to understand each other and come together, and the community members receive the care and services they need and they should receive, and the health providers are able to receive more knowledge about how to treat these communities.
We've put out a new document, a playbook that we think will be useful for public and private institutions that are interested in more authentic community engagement, specifically leveraging the roles, capacities, and expertise of community health workers. It's called Advancing CHWs and COVID-19 Response Strategies, or also known as the Playbook. The National Association was proud to partner with the Community-Based Workforce Alliance. This playbook is important for you to provide you guidance on how to conceptualize and operationalize CHW engagement in your COVID-19 response. The Community-Based Workforce Alliance is proud to endorse this playbook, and I'm encouraging each of you to consider it to drive health equity, to drive more authentic community engagement, and to really promote sustainability in your COVID-19 response strategy through partnerships with community health workers and our networks, associations, and coalitions. Thanks so much for your time.
Visit the website below to access the playbook and to learn more about the community-based workforce.
All right, let's get started. Hello, can everybody hear me? Nod your head if you can. Awesome. Hello and happy Saturday. Everyone, welcome to our virtual graduation ceremony. My name is Quisha Umemba. I'm sorry, I thought somebody was saying something. My name is Quisha Umemba. I'm the CEO and founder of Umemba Health, LLC. Today is a very joyous occasion for me because we are graduating not only community health workers that will go on to become change agents and to save and improve the lives of the people that they serve and work with, but because we are graduating the first clinical community health workers from our program. I'm so excited to be able to share this joyous occasion with you all, and I'm so glad that you took an hour of your time, hopefully not that much out of the day, to be here. We don't want to take too much of your time, so I want to briefly just tell you a little bit about Umemba Health before I turn it over to our primary CHW instructor. Umemba Health, we're about 1.5 years old, and we are a public health and education consulting agency. Originally, in pre-COVID, we were client-facing. We offered client-facing services, chronic disease, primarily diabetes, education, and consultation. And after COVID-19 and seeing the ravaging effects that it had on vulnerable populations, I saw that I needed to turn the direction of our services to serve those that served others. So it's been about 1 year now that we've been providing education and training for community health workers. And only since February, since we've been actually certifying individuals to become community health workers. I shared that video with those of you that may not be aware of what a community health worker is or does. Hopefully by now you have spent some time with your loved ones and they've explained what they do to help others. If you know anything about the discipline in the profession, please help spread the word. I really believe that every community, every hospital organization, every healthcare system is served better when we have frontline health professionals like community health workers. I think it's important that you understand we do have a philosophy when it comes to our teaching and our training of frontline health workers, and I'd like to share that philosophy with you today. We believe that frontline health workers are the heart and soul of healthcare and public health. We believe that healthcare workers and public health professionals have incredible expertise, and by empowering them through online learning and virtual training, we can make a larger impact. We can reach more. Thus, we can save and improve more lives. We believe that health and public health education can be made accessible and can be affordable to all learners. And we do this by creating exceptional learning experiences using our digital tools. We believe in education and training that provides an interactive and engaging experience, because this allows learners to receive the information and to easily replicate it in the real world. We believe that investing in frontline health workers and community health workers is a win-win for everyone, producing positive results for workers, employers, and communities. And with that being said, I'd like to turn it over now to our primary community health worker instructor, Ms. Farhana Khan, and she will introduce our CHW candidates for the spring 2021 cohort. You have the floor, Farhana. You're on mute.
And I guess, yeah, now you can hear me. Thank you so much, Quisha. That was so beautiful. And I really appreciate all the decor that you have done. It seems like you are wearing your graduation gown and
Joking me.
That is so cool. I love it. I love it. Welcome everybody. I am so excited to be here, to see you all and to go through this process. I have to tell you that Quisha has been doing this for a while, probably, but this is my first online teaching. I've done some in-person teaching, so it has been a heck of an experience. So I really enjoyed it, and I enjoyed having you in the class. And I have to tell you that I have learned so much from you, as you probably have learned from me, and I'm very proud of the team. I know we started out with a bigger group, but we ended up with the cream of the crop. So I have no doubt that all 5 of you are gonna go out and make an impact because you guys are the best. You were attentive, you were enthusiastic, you were responsible for your homework, and you were passionate about what you were learning. And I think the most important part was being passionate about that you really care. So that motivated me more. And as we went along, you know, I became more excited. So I'm very proud of all of you for finishing it up with pride and such good grades and with awesome homework and great contributions. So I'm going to call the names of the graduates one by one. The first one is Angela Brooks. Well, Angela Brooks has been such a great contributor to the class. And I have to say that her enthusiasm is infectious. And she brings a lot of new, I think, input coming from Minnesota. So I think she was the farthest for me as a student. So she has all those wonderful stories from Minnesota, and that added a lot of interest in the class. Angela's favorite quote is, "What lies behind us and what lies before us are but tiny matters compared to what lies within us." And this is by Ralph Waldo Emerson. Congratulations, Angela. You have graduated. Yay! All right.
Thank you.
Next graduate is Grace Geraldo Gonzalez. And Grace is coming from Miami, so she has all those wonderful stories from Miami. And I have always enjoyed reading Grace homework. So every other homework that Grace submitted, I would say, this is a model homework. I have to share it with the rest of the client. And then the next homework would come and it would be so well formatted, and the choice of words would be great, and the level of detail would be exceptional. And I'm like, oh my God, this is a next model homework. I have to share it, until I stop sharing it. I'm like, Grace has too many good homework. So Grace puts her thoughts very clearly, you know, when she's writing. So my vision is that she is going to be working on a lot of presentations and a lot of flyers for community health worker or public health. Grace's quote is, just living isn't enough. The butterfly, one must also have freedom, sunshine, and a little flower. Beautiful, by Hans Christian Andersen. Grace, congratulations, awesome. Our third graduate is Brenda Godoy. And Brenda, you have brought so many new ideas. And now, is Brenda here? You see Brenda here?
Yes.
I'm right here. Brenda, you're here. Yes, yes, yes. My view is sideways, so I have to keep flipping who's in and who's not. Okay. So Brenda has brought real global health stories in the classroom. And she would tell everybody else about her mission trips. And that made me so, it revived my mission to do some mission trips whenever I have an opportunity. Another thing I really appreciated about Brenda, that when she did talk, and she became such a better conversationalist at the end of the class as she was before. She had the most unique ideas. She had the most unique vision for what she wants to do. So Brenda, I want you to write it down and do not lose that vision, okay? And continue to work on it, especially the one that you wanted to make a buddy system in the universities for special needs children. I thought that was a great idea. So you need to hold on to that dream. That was a beautiful idea. And Brenda's favorite quote is, "For I know the plans I have for you, declares the Lord. Plans to prosper you and not to harm you. Plans to give you hope and a future." And this is from Jeremiah 26:11. Congratulations, Brenda. Great quote to decide. And our fourth graduate is Hanaya Johnson. And Hanaya has always contributed so eloquently in classroom. And she always has a great smile. She is my one student that does not let go of the smile, whether she's writing, she's looking down, she's looking up. She has always that beautiful smiles that brings warmth to the classroom. She is very attentive, and she has that unflinching commitment. She's regular, she completes her homework on time, and I am so impressed. She's my only person who actually wrote a book. So there is something for us to look up to. Hey guys, if Hanaya can do it, we can do it too, okay? So, and also great stories from the work that Hanaya is doing. Hanaya's quote is, "Research is formalized curiosity. It is poking and prying with a purpose. It is a seeking that he who wishes may know the cosmic secrets of the world, and they that dwell therein." And it's actually from Dust Tracks on a Road, 1942, by Zora Neale Hurston. Beautiful, beautiful. Congratulations, Hanaya. Yay. All right. And our final graduate is Becca Ortiz. I am very impressed with Becca's composure, maturity, and her compassion, her comparison of corporate world versus the public sector. So she brings a unique perspective to the classroom. And I have also appreciated how she brings her organized thoughts with in a very composed manner, but yet she tickles the curiosity of the rest of the students. Like, think about it, think about it. And she asks us to tickle the other parts of the brains that we're not thinking about it. So Becca, thank you for being bringing the unrest into the otherwise rested mind. Becca's favorite quote is, "Growth exists on the edge of what brings fear and discomfort." Awesome, and that's what Becca has been doing. Thank you, Becca. Congratulations. All right, these are the 5 graduates from Umemba Health Academy CHW program. Yay!
Thank you so much for that, Farhana. Everything that you said about the graduates was spot on. At this time, we would like to give the graduates an opportunity if they have anything that they would like to say. And I guess we can go ahead and start in the same order in which we presented them. So Ms. Angela Brooks, would you like to say a couple of words?
I just want to say thank you, Quisha, for this class and for this opportunity. It has been an amazing just learning environment. I've enjoyed learning more about community health worker and my role in this, and just learning from the other students. And then Ms. Farhana has been an awesome teacher since the beginning of just helping us and also just expanding our minds and giving us that global mindset, especially from where she comes from, and bringing those different perspectives of what the world looks like and what we will be involved in. So I thank you guys so much, and I will miss seeing you all and the other students and talking to you guys. So thank you all and wishing you all the best.
Thank you, Angela. Grace?
Good afternoon, everybody. I am so excited. My family is all here. We're gonna have a beautiful lunch. And I wanted to thank Quisha, of course, for giving me the opportunity to take this class, which has been wonderful. And also for having such a beautiful teacher, Farhana. You're so warm and kind and so enthusiastic. I really love the way you teach. I would like to follow your steps all the way. So thank you very much to all my students. I mean, we did a great job working together, and I think we learned a lot. And I hope to continue with my CHW trainer class and be able to promote this program because I think it's wonderful. And I am very lucky to have found this program in Texas, all the way in Texas. So thank you very much. I'm very excited. I'm so happy, and congratulations to all of you. And thank you, guys.
Thank you so much, Grace. We're so glad your family could join today.
Thank
and
you.
Next is Brenda.
Good afternoon, everyone. Thank you so much, Quisha, Farhana. We learned a lot from you. I remember I signed up for this course like at the very last minute, and Quisha was so warm and welcoming. Like even like I was, I think, past the due date to sign up, but she welcomed me very sweet, very nice. And I really thank you for this opportunity because you gave us a lot of resources, a lot of like certifications, like the mental health first aid, the basic life support. It wasn't just content, but like just a lot of good things that come from this. And for Hannah, I really thank you for everything, all the feedback that you gave me, all those lectures. Thank you for putting up with me and all of us. I really thank my classmates. I not just only like learn from Quisha and Farhana from the lectures, but I also learn from each and every one of you. Your past experience, just enlighten me and just help me see the world differently. And thank you so much for that.
Thank you so much, Brenda.
Welcome.
Anaya?
Like the other ladies, I've enjoyed this very thoroughly. The content of the course was very well put together. So I thank you both, Farhana and Quisha, for this experience. Just can't wait to get started and implement everything you guys have taught us.
We're excited to see you implement it also. Thank you so much. And last but not least, Rebecca.
I'm so excited to have met all of you, and I didn't know what the expectations were going into this course, but I'm glad that it's all been women and we have like this safe space online. And it's actually, even though it's in a virtual space, it's been there's still a camaraderie and there's still that warmth. And I love the feedback we all give each other. And I'm so glad to have met all of you from different backgrounds and experiences. And I'm excited to, like Hanaya said, implement the CHW work in the community. And I would love to get to know all of you in IRL as things are opening back up. I have my friend Gabby here from San Francisco. So I would love to visit City College actually and get to know the contacts over there in San Francisco. So thank you all. Thank you, Quisha. Thank you, Farhana.
That's awesome. You're in San Francisco. That's awesome.
I'm not in San Francisco. She's from San Francisco.
She's from San Francisco. Okay.
I'm just kidding.
Well, thank you for joining, friend. We're glad to have you here as well. And speaking of friends, we're going to give friends and family members an opportunity to speak. But I guess now it's time for me to do the commencement address. So let me actually pull up a different screen. Y'all know I'm long-winded, right? But this is not going to take long at all. I promise you. I gave this presentation, I don't know, a couple of months ago to the Texas Society of Medical Students. And so when I was thinking about what would be the best thing to talk about to you all, you see, I didn't even change the date on the screen. I thought, oh, they need to know about those self-limiting constructs that will actually stop you from achieving all of your goals. And so that's what we're going to talk about today. What are you waiting for? Because the world is waiting for you. There are 4 things from my personal experience that I have found to be what I call enemies of progress. And I want you ladies to make sure that you do everything that you can to make sure these self-limiting constructs, these enemies of progress, do not stifle you and keep you stagnant. So the first one we're going to talk about is fear. Nothing's wrong with fear. There's a basic human emotion. It was wired into our systems for a beneficial purpose, right? So back in caveman days, it signaled to us times of danger. It prepared us physically for what needed to be accomplished. It was necessary for survival. But you see, the issue with fear is when it becomes limiting and capacitating to you. Because fear sees only the downside, only the negative in everything. Fear doesn't let you stop to think things through or weigh the options. Fear tells us to avoid anything new or unknown or anything we don't think we're going to be good at doing. And fear often keeps us from making decisions at all. You may have heard this saying about fear. It's false evidence appearing real. Fear will keep you from your assignment. And I want to tell all of you ladies, you all have an assignment. If you cannot see the calling on your life, trust me, Farhana, Devana, and myself, we can see the calling on your life. After the short 16 weeks that we've been with you, we can see what you're good at. We can see the individuals and communities that you would work best with and how you would be, your skill set is going to be well suited to serve that population. But if you don't overcome this false evidence appearing real, it will hold you back from doing something that you know you can do and that you know you should be doing. Fear is crippling. It feeds stagnation and it will keep you from taking advantage of opportunities. Don't live in a self-made prison of fear, okay? The thing that you need to do to overcome fear is to redefine failure and success. During a commencement speech, the Oscar award-winning actor Denzel Washington told the graduating students to fail big, fail fast, and fail often. He went on to say that every failed experiment is one step closer to success and that students should take chances professionally. I know this ideal seems strange to you, but most successful people will agree, even myself, because I've redefined my own version of success. I'll tell you that you will fail. You will pass failure several times on the way to success, but you want to for a number of reasons. One, because you're not starting over every time you fail, you're starting from experience. You're not starting from scratch. You're starting from been there, done that, got the t-shirt. You're not starting from failure. You're starting from, I learned from that. And not only did I learn from that, but I have a story to tell with other people. I can be a mentor and tell other people, you know what, you might want to take a detour. So don't let the fear of failure or the unknown cripple you from realizing your ultimate potential. So now, self-limiting construct number 2, the comfort zone. This is one that a lot of people will struggle with, but I'm telling you, the world is not going to get your goodies if you stay in the comfort zone, if you stay in what feels safe and what feels familiar and habitual. When you're in the comfort zone, sure, there's low levels of stress, there's low levels of anxiety, but in your comfort zone, there's no risk either. And we all know that with risk comes reward. There's nothing wrong with spending time in the comfort zone. Don't get me wrong. Every once in a while, we all need to relax. Every once in a while, we all need to take it easy. We all need low key every now and then. But the problem with the comfort zone is when it starts to get too comfortable in the comfort zone. When this happens, you stop striving to achieve your goals. You stop challenging yourself. You let opportunities slip by. You become overly complacent. And the only way to grow, to build your capabilities, to reach your full potential is to step outside of your comfort zone. The comfort zone is overrated. Do it anyway. Do it scared. Y'all have heard me say before, and people don't believe me, no matter how many times I have to present like I'm presenting now, I get anxious. It's better because we're in a virtual environment, right? You're in your house, I'm in mine, I'm cool. But if I had to do this in a room full of people, seriously, my body would be rejecting my internal organs. But guess what? I figured out a long time ago that the world was waiting for what I have to offer. So I learned to get over myself. I learned to push through that uncomfortable feeling. I had to learn to be comfortable with being uncomfortable. And you know what? I like money. And there's no money in the comfort zone. There's no growth in the comfort zone. There's no progress in the comfort zone. And if we're talking about career, there's no promotion in the comfort zone. So don't let this self-limiting construct, don't let this enemy of progress stop you from achieving your dream. Do it scared. Put yourself in new environments. Don't pick the safe choice or the easy choice all the time. Take a different route. Even if you're driving home from work, don't always go the same way. Make a snap decision sometimes. These are things that will help you get out of the comfort zone. Self-limiting construct number 3, the imposter syndrome. I'm just gonna say it. All of you are women that graduated. Women have imposter syndrome more than men, but it's something that everyone encounters once in a while. If you don't know what it is, it's feeling like, I don't think I'm the right person for this job. This job description says they want somebody with a master's and I just have a bachelor's. I don't know if I should join that committee because everybody has PhDs on that committee. Trust me, been there, done that, got the t-shirt. The imposter syndrome is something we all have hid behind every now and then. Your brain is saying, I don't know as much as these people, but in reality, you know just as much as everyone else does. In all honesty, when it comes down to it, it's not about knowing everything. It's about asking for help when you get stuck. And it's about knowing where to go when you don't have the answer. And my students know, I'll tell you in a minute, I have a PhD from YouTube University and a degree from Google Community College, right? So I know where to find answers if I don't know. And guess what? Everybody does that. So leave this imposter syndrome mess, leave it here today with you. Once we do our fake cross the tassel here in a little bit, let these things, these self-constructing, limiting beliefs, leave them here today. How do you get out of imposter syndrome? The only way to stop feeling like an imposter is to stop thinking like an imposter. A year ago, or maybe a couple of years ago now, before I started my business, I hired a business coach. And when we first got started, she used to always harp on mindset. Quisha, you got to work on your mindset. You got to work on your daily affirmations. I got so sick of her talking about mindset. I'm like, that's the wrong M. I just want to make money. Tell me what I need to do to make money. But every day I did it. I did what she said because she's making money and I'm not. So let me at least do what she's telling me to do. So every day I made it a point to work on my mindset, spiritually, motivational, inspiration. I'm reading, I'm podcasting, I'm YouTubing, I'm mentoring. I ate, drank, sleep, working on my mindset and the self-limiting construct of imposter syndrome. And I even started to write down the things that she told me to do, those daily affirmations that I repeated to myself. I'll read a couple of them to you so you understand what this looks like. This comes from my daily affirmations book. I am paid to solve problems. I solve problems for healthcare organizations that I learned to master as a nurse. I am a subject matter expert. I influence individual and organizational outcomes to evolve healthcare and public health delivery. My earning potential is limitless, and it's based on the value that I bring to the clients that I serve. I am multi-dimensional, and my productivity will not be paralyzed. I am a builder of capacities. I am a visionary that helps dreams become realities. I promise you, if you say things like that to yourself every day, especially if you're looking in a mirror, you cannot help but to change your mindset. The last thing that I've learned has been the biggest enemy of progress to me is a little thing called perfection. I'm telling you now, if you are one of those people, you have got to leave perfection at the door. Perfect Patties don't start projects because it's not perfect. Perfect Patties don't release songs or write books like Hanaya or come up with products or services or ideas like Brenda or make people think out of the box like Becca, because it's not perfect. It's not perfection. It's not a finished product. But I'm telling you right now, you better start understanding that done is better than perfect. Progress is what you strive for, not perfection. Life is research and development. I didn't want to launch this program in February. It wasn't ready. I didn't think it was perfect. I didn't think it was going to be the best thing, the best curriculum, the best delivery. I didn't even know who was going to teach it. God blessed me with Farhana and Devana. But you've got to get out of that. Done is better than perfect. Release that idea, release that book, release that song, release that service, and let your clients give you feedback. Let them tell you how it works or how it doesn't work, how it can be improved, and then make improvements. And not just in personal life, in business as well. This is the same thing at work. So those are the 4 constructs: fear, comfort zone, imposter syndrome, and perfection. Leave those here today, ladies. And I have no doubt that you all will be unstoppable. The world is waiting on you. So get yourself together. And I think today, graduating as a community health worker is the first step in the right direction. So that's all I have. I promise you I wasn't going to be long. I'd love to open up the floor for any friend or family member, loved one that would like to say something about their graduate. And I also would like to give Devana, our secondary instructor, an opportunity to say something as well. So the floor is yours.
Okay, I will go if no one else. Hello, everyone. Thank you for being here. Quisha, this is so cute. I love this. So cute. I'm so happy that you guys all have a good support system here. And I really just want to commend you and tell you how proud I am of all of you for taking this step. I mean, coming to get a certification is something extra. It's not required of you. This is something you chose to do personally or professionally for whatever your reasons are. It's something I strongly admire. As Farhana mentioned, we started with a larger class and people just kind of fell off for whatever reason, but you stuck with your commitment. You said, whatever was within you, said, I'm going to finish this and I'm going to get the certification. I'm going to better myself and learn things I didn't know. And I really appreciate you guys struggling through us as we had, technical difficulties, as Quisha mentioned, this is the first time going through, and you guys really stuck with it and you were willing to give your feedback and just roll with whatever came. I mean, and those are skills that we have seen you exhibit here in this class that you will definitely be able to take out into the field. So congratulations to all of you. You have done amazing. We're so proud of you. And I can't wait I'm connecting with all of you on LinkedIn, I think. So I can't wait to watch what you all do in the future. Congratulations.
Thank you so much. Are there any friends, family member, Or anyone else that would like to say something? I have something that just will not go away here. Becca, does Gabby have something to
she almost
say?
didn't let me unmute her. She was like, what are you doing? I was like, let me give my remarks, Becca. No, I just want to say Becca has grown so much in these last couple of weeks and months that she's been in the program. I can already see how excited and thrilled she is to apply all the things that she's been learning with you guys. Every time we talk, she just shares all the things that she's learned in this class, in this course, and I'm very, very proud of her. I'm proud of how far she's come.
Thank you.
I'm proud of her story, and yeah, congrats everyone, and yeah, good luck in pursuing your ventures as well.
Thank you so much, Gabby. We appreciate that, and certainly happy to see that Becca has that wonderful support system. I'll give about 10 seconds for anybody else. If you have anything to say, just unmute yourself and you can go ahead and speak on behalf of your graduate.
Hello, I'll jump in. My name is June Ellen. I'm Becca's mom. We're such a small family. It's myself and 2 daughters. And I'm so proud that all 3 of us are in healthcare in such different and unique ways. So I just can't wait to see what Becca does next. And I think we're all inspired by things that have happened in our lives to follow this pathway. So trust the process, Becca. I think you're going to really be a great contributor. And I think I'm also, as a mom, you're always happy to see your children. And I know she's a grown up, but you're always glad to see your children surrounded by positive people. It can't be a better feeling, or it can't be a better thing. So I'm so glad to see this community. And I have a feeling you guys are going to be friends for life, which is awesome. So congratulations to all of you.
Thank you so much, Becca's mom. Beautifully said, beautifully said. Any other opportunities anyone else would like to speak? Okay, so at this time, we do not, I couldn't even find my cap, right? But I would like to do the turning of the tassel as a symbol, right? And so we're gonna start from left to right when we turn this tassel. And when we turn this tassel, the right side is gonna be a new beginning. So the left, we're leaving all of those self-limiting constructs behind us, the fear, the comfort zone, the imposter syndrome. What was the last one? The perfectionism. We're leaving it behind us. And when we turn to the right, you're gonna be clinical community health workers, and you're going to be ready to take on the world. How does that sound, ladies? Sound good? All right, so here we go. Let me make sure I can see everybody's face. All right, I can see everybody's face now. So we're gonna start on the left side. Pretend like you've got your tassel up here. Oh, Grace has got hers. Awesome. Let's give you time to get it together, Grace. Anaya has hers. Awesome. Yes. Awesome, awesome, awesome. Okay, so we got the tassel on the left. All righty. Here's to new beginnings for the class of spring 2021. On the count of 3, we're gonna turn from left to right. I see you, Brenda. 1, 2, 3. Woo! Congratulations, ladies.
Yay!
And all that you've done, I can't wait to see about what you're going to do in your future. With that being said, please enjoy your Juneteenth weekend.
And what a great day to celebrate a Juneteenth, the first time it's a federal holiday. So I'm really excited about it. Happy anniversary, Keisha.
Thank you. It's my anniversary. It's just a great day for me today. Absolutely.